Just a moment.
Bhavnita, if you can put it on a slideshow.
Yes, I am trying to do that slideshow from beginning, but it is not starting from there.
Yeah.
Just a moment. I'll share my slide once again. Sorry for the inconvenience. Yes, it's done now.
Yeah, that's fine.
Thank you so much for waiting, everyone. Just a moment. From beginning. Yes, so my introduction is done. And first, I'll start with what is yoga. So we all think that yoga is just a mere physical activity or just physical exercise, moving your arms or legs. So I'm going to tell you that yoga, it's not just physical postures. It is beyond that. And now it is in yoga, it comprises of breath, mind, and body. With breath, it is the most neglected one because right now, how you all are breathing, are you aware of that? No, because most of the time, because when we are in a stressful situation, we try to breathe faster. And with yoga practices, we do some pranayamas that are in yoga. Pranayama means breathing exercises. With breathing exercises, we channelize our breath flow throughout the body because sometimes when we are not breathing regularly, like when our breath is irregular, it tends to create problem in a part of the body where the channel of the where the breath flow is not proper. And the second is our body. With our body, we do physical postures to maintain our internal systems, like we boost our immunity, we keep our immune system healthy, we work on circulatory system for proper blood flow, and so on, that we are going to discuss later. And the third and the most important is mind. Our mind is like the root cause of all the problems that happen to us, because most of the times we are just thinking of so many things that we are not aware of what is happening in our body. And in yoga, we comprise breath, breathing exercises, postures, and mind means meditation and relaxation. So all these things are together inculcated in a yoga practice. I'm sorry, what is happening to me? I'm really sorry. Okay, so let's discuss like how yoga can help you in maintaining a healthy heart. So the first is we have to manage our stress. And it is something that we cannot totally avoid because in day-to-day life, we are in some situations where we have to deal with our stress. We are at work, we have to deal with that work stress. So what we can do is with yoga, we can manage our stress with this practice of breathing, postures, and meditation. It has the ability to relax the body and mind, which will ultimately help you in maintaining a healthy heart. And with yoga practice, we work on, there are two systems, sympathetic nervous system and parasympathetic nervous system. So when we are at the risk of heart conditions, our sympathetic nervous system is overactive. So sympathetic nervous system it is responsible for flight and fight response. Like whatever we are doing when we are active at that time, in simple terms, it is sympathetic nervous system. And parasympathetic is just rest and digest. When we are at complete relaxation, we are at ease. So when we are at stress, our sympathetic nervous system, it pulls up, it is overactivated. And there is a pranayama in yoga, it is called anulom vilom or nadi shodhan, like alternate nostril breathing. In technical terms, it helps in managing both sympathetic and parasympathetic nervous system. So that, and these systems should work in balance always, not like parasympathetic is going over and sympathetic going down. It should be in balance. And are you all with me? Okay, yes, I can understand you all are with me. Okay, so with yoga practice, we can help in reducing the risk factors, like the one of the major risk factor is blood pressure. It can help in lowering the blood pressure, lowering bad cholesterol levels, and the wonderful that I love is lowering stress and anxiety. I have seen the difference, and I have seen this difference in so many people, those who used to be very anxious, like anything happens in just a moment, they will get anxious. But with a regular yoga practice, combining breathing, postures, and meditation relaxation, they all are doing good now. And the next is because of obesity, also, we are at risk of heart conditions. So it helps in managing weight, and it helps in improving our heart rate, plus boosting blood circulation throughout the body. And when we are doing some exercises like in the upper body, and when we are channelizing the blood flow towards the extremities, our heart is not at strain. It is not pushing too much to send blood circulation towards. So there are so many postures, and it is advisable that every day we have to keep our legs up when we are in the bed or you are on your sofa. Just keep the legs up, hold there, so that it will help in backward flow circulation towards the brain, towards the heart. It will help in relaxing the heart. Plus so many benefits happen, like it will help in keeping hormones in balance, keeping our heart rate well. So many things happen. So when you will be doing a yoga session, then you will get to know all these things in detail. Okay, and the next is cardiovascular related to heart. Our heart is a muscle. Yes, so with yoga, we just think of exercising our muscles in the arms, legs, or back. So we have to work on maintaining a healthy heart, as the important muscle that is keeping us alive, our heart. So yoga has profound benefits in cardiovascular system. So it helps in managing blood sugar levels and boosting metabolism. Plus, lowering cortisol is a stress hormone. So it helps in reducing the cortisol level, the bad hormones, and boosting up higher feeling good hormones. And next is, I have seen in my experience, in some cases, doctors have suggested that you need not take any medication, or in some cases, doctor has reduced medication also. So it is such an approach. If you can just imbibe this practice of yoga, it will definitely do wonders to you. I'm teaching for the last almost 3 years now. With my experience, I can just say, please, please practice yoga, and we are keeping every bad thing at bay. Nothing can harm us. Plus, during these times in COVID, we have to boost our immunity. That has also helped. Postures, breathing, and meditation, everything all together does wonders. And next is, I have seen some people think that they cannot do yoga because they are overweight or they are not that much flexible. It is wrong. People at any age, they can start yoga, and every body type can do yoga. And for every body, it is different what practice you should be doing. So I specialize in conducting personalized one-to-one sessions only, which are based as per your goals and needs. So accordingly, understanding your body, understanding your needs, we design the sessions. So all the postures are also simplified in a gentle way and at a slow pace. Plus, the wonderful yoga has physical, mental, and emotional well-being. It works on that, on all these things. And you can do yoga with any other exercise. If you go to cycling, go to walking, you go to gym, yoga supplements every other exercise in maintaining a healthy body, plus healthy heart also, which is keeping us alive. And yoga that we just discussed, it is not just doing postures or meditation or just breathing. So yoga is a way of life. You have to live a yoga way of life, as in, how is your mental state during the rest of the day? You practice 1 hour on your mat, you did yoga. No. How is your mental state during the day? Do you get easily aggressive? Are you more anxious person? So you have to work on that, working on each and everything that you need, maintaining a healthy body and a good lifestyle. And the last is, in yoga, we don't, like I said, it is a holistic approach. We will work on managing our stress so that we can maintain a healthy heart. Plus, good sleep is the another most important thing, because if you are not sleeping well, if your sleeping is irregular, then it will create an havoc. So you have to work on regulating sleep as well, managing your body weight so that there is no blockage around the arteries or in the arteries. Plus, exercising, doing yoga postures with breathing and meditation is a must. Everyone should do. And please stay away from all the intoxicated items, drugs, smoking, and all these things. And the most important, another that will help you in maintaining a healthy lifestyle is what you eat. That Miss Hadil will be talking about in some time. So please listen carefully and just take care of everything. Enjoy, have a healthy heart, try to reduce, manage your stress. Stress is there every time. If you are going to get a cup of water, you are stressing your body to just get up. But it depends, like, is it a good stress or a bad stress? If the stressful situation is like it is impacting your body, then try to stay away from negative places or negative people, because we are most of the time surrounded by them. Try to stay away from them and inculcate a good habit, a yoga habit, way of life will definitely help you all. And last but not the least, our yoga initiative, our motto is be yogative, means a yoga way of life that you can incorporate in your lifestyle. Like I said, these sessions are conducted globally. Wherever you are in the world, you can do yoga with me. And these are private one-to-one sessions. And if anyone wants to discuss about yoga, how it can be of help to you, please feel free to consult with me for a free counseling. And you can click a picture. Here are my details. I hope everyone is done clicking the pictures, or I'll share at the end also. Thank you so much, everyone. I will stop sharing now. Now Miss Hadil will take over. Thank you so much.
Thank you very much, Bhavnita. That was a wonderful presentation. And I can certainly say that yoga once a day will keep the doctor away. So those listening surely will be motivated to join your yoga classes online, or if they have any opportunity to join live. So thank you once again, Bhavnita.
Thank
so
you.
Please stay back for the question and answer session, which we will have at the end.
Yes.
So with that, now I would like to invite next Riona Kapasamy. Riona Kapasamy, first of all, let me tell you, ladies and gentlemen, she has joined my place of work, which is Awali Hospital in Bahrain, very recently. So now she is a new colleague for me. Riona is a South African trained physiotherapist. She has obtained her bachelor's degree in 2007 in physiotherapy. She then obtained her postgraduate degree in 2014 in physiotherapy from University of KwaZulu Natal in South Africa. She has over 13 years of experience working in various private sectors in South Africa and in Bahrain. Riona has a wide experience in different disciplines of physiotherapy. She is experienced in dry needling, neuro and musculoskeletal disorders, pediatrics, orthopedics, physiotherapy-related problems, as well as cardiac rehabilitation. Riona is going to speak on exercises for healthy heart and cardiac rehabilitation. So over to you, Riona, whenever you are ready. Please start.
Thank you, Doctor. Hello, everyone. I'm Riona, and I'm going to be talking about cardiac rehabilitation today. What is cardiac rehabilitation? Cardiac rehabilitation is a complex and interprofessional intervention customized to individual patients with various cardiovascular diseases, such as coronary artery disease, heart failure, myocardial infarctions, and patients who have undergone cardiovascular interventions such as coronary angioplasty or coronary artery bypass grafting. Cardiac Rehabilitation Program. The cardiac rehabilitation programs aim to limit the psychological and psychosocial stresses of cardiovascular disease, to reduce the risk of mortality secondary to cardiovascular disease, as well as to improve the cardiovascular function to help patients achieve their highest quality of life possible. Accomplishing these goals is a result of improving overall cardiac function and capacity, halting or reversing the progression of atherosclerotic disease, and increasing the patient's self-confidence through gradual conditioning. Cardiac rehabilitation is the process by which patients with cardiac disease, in partnership with a multidisciplinary team of health professionals, are encouraged to support and achieve and maintain optimal physical and psychosocial health. The involvement of partners, other family members, and carers are also very important. Indications for cardiac rehabilitation. Cardiac rehabilitation should be offered to all cardiac patients who would benefit. This includes recent myocardial infarction, acute coronary artery syndrome, chronic stable angina, congestive heart failure, after a coronary artery bypass surgery, after percutaneous coronary intervention, valvular surgery, and cardiac transplantation. What are the goals of cardiac rehabilitation? Comprehensive cardiac rehabilitation program should contain specific core components. These components should optimize cardiovascular risk reduction, reduce disability, encourage active and healthy lifestyle changes, and help maintain those healthy habits after rehabilitation is complete. Cardiac rehabilitation program should focus on patient assessment, nutritional counseling, weight management, blood pressure management, lipid management, diabetes management, stopping of tobacco smoking, psychosocial management, physical activity counseling, and exercise training. There are 3 phases of cardiac rehabilitation. The first phase is the clinical phase. This phase begins in the inpatient setting soon after cardiovascular event or completion of an intervention. It begins by assessing the patient's physical ability and motivation to tolerate rehabilitation. Therapists and nurses start by guiding patients through non-strenuous exercises in the bed or at the bedside, focusing on a range of motion and limiting hospital deconditioning. The rehabilitation team may also focus on activities of daily living and educate the patient on avoiding excessive stress. Patients are encouraged to remain relatively rested until completion of treatment of comorbid conditions or post-operative complications. The rehabilitation team assess patient needs such as assistive devices, patient and family education, as well as the discharge planning. The second phase is the outpatient cardiac rehab phase. Once a patient is stable and cleared by cardiology, outpatient cardiac rehabilitation may begin. Phase 2 typically lasts 3 to 6 weeks, though some may last up to 12 weeks. Initially, the patients have an assessment with a focus on identifying limitations in physical function, restrictions of participation secondary to comorbidities, and limitations to activities. A more rigorous patient-centered therapy plan is designed, comprising 3 modalities: information, advice, tailored training program, and a relaxation program. The treatment phase intends to promote independence and lifestyle changes to prepare patients to return to their lives at home. The last phase is the post-cardiac rehab phase, which is also a maintenance phase. This phase involves more independence and self-monitoring. Phase 3 centers on increasing flexibility, strength, and aerobic conditioning. The goal of this phase is to facilitate long-term maintenance of lifestyle changes, monitoring risk factor changes, and secondary prevention. This is a sample format of how we run a cardiac rehabilitation class. We have the check-in, where the vitals are assessed, a warm-up, which is 15 minutes, the main class, which is 30 minutes, the cool-down, which is 10 minutes, and lastly, the monitoring and reassessment of vitals and checkout. In the warm-up phase, the purpose is to prepare the body for exercise by raising the pulse rate in a graduated and safe way. The effects of this is it redistributes blood to active tissues, it increases muscle temperature and speed of muscle action and relaxation, it prepares the mind, and it prepares the muscle for the range of movement involved for conditioning period. It should include pulse raising activities for 5 minutes. Example, marching on the spot, walking, low-level cycle, followed by stretching of the major muscle groups, followed by more pulse-raising activities. Next is the main class. For group rehab circuit training seems most popular, and depending on the cardiovascular status and functional capacity of patients, they may adopt an interval or continuous approach to the circuit. Separate stations are set out, and participants spend a fixed amount of time at each aerobic station, lasting anywhere from 30 seconds to 2 minutes before moving on to the next station, which may be a rest station or active recovery in the form of resistance work. Resistance work includes 10 to 15 reps to moderate fatigue of 8 to 10 exercises. Obviously, there's an individualization of the cardiovascular component, and it can be achieved by varying duration spent at each station, the intensity, the period of rest, or the overall duration of the class. The cool down period. This is the last 10 minutes at the end. The goal is to bring the body back to its resting state. It should incorporate movements of diminishing intensity and passive stretching of the major muscle groups. It is necessary because it increased risk of hypertension. Older hearts take longer to return to resting levels, and the raised sympathetic activity during exercise increases the risk of arrhythmias immediately post-exercise. Now we will move on to exercises for a healthy heart. In the simplest terms, therapeutic exercise involves movement prescribed to correct impairments, restore muscular and skeletal function, and/or maintain a state of well-being. The scientific evidence demonstrating the beneficial effects of exercise is indisputable, and the benefits of exercise far outweigh the risks in most adults. For most adults, an exercise program including aerobic, resistance, and flexibility is indispensable to improve and maintain physical fitness and health. What is the difference between physical activity and exercise? Physical activity refers to the contraction of skeletal muscle that produces bodily movement and requires energy. Exercise is a physical activity that is planned and performed with the goal of attaining or maintaining physical fitness. Physical fitness is a set of traits that allows an individual to perform physical activity. Commonly used exercises, we divide them into 3 groups. This is your strengthening exercise, your endurance exercise, and your flexibility exercise. Strengthening exercises usually performed with heavy resistance and fewer repetitions. The endurance exercise that engage large muscle groups over a longer period of time in the area of 50 to 60% VO2 max to achieve greater cardiovascular endurance. And flexibility exercise achieved through stretching and movement. Endurance exercises. How often should you be doing it? Exercise should be carried out 3 to 5 days a week. Training 3 times a week produces significant training effects. However, training 5 days a week at a low intensity exercise may be more manageable for some people. Intensity. How hard should you be training? Intensity refers to the rate at which the activity is being performed or the magnitude of the effort required to perform an activity or exercise. It can be thought of how hard a person works to do the activity. Intensity can be monitored by heart rate in most patients, although some patients may have pathology or be on drug treatments that affect their heart rate response to exercise, in which case the heart rate cannot be used to monitor exercise intensity. Exercise is categorized into 3 different intensity levels: your low, moderate, and vigorous levels. Walking is the most common form of endurance exercise practice, and it is the most frequently recommended by doctors as well. Walking can be easily incorporated into a daily schedule. Studies have shown that seniors who walk at least 2 miles a day on average lower their mortality risk by 50%. Other good forms of endurance training are swimming, cycling, dancing, walking upstairs instead of taking the elevator, golf, which involves walking, gardening, or heavy yard work, and low impact aerobics. How long should you be spending on endurance exercises? A total of 20 to 60 minutes of continuous or intermittent aerobic activity a day should be performed. The activity can be divided into a minimum of 10-minute bouts throughout the day. Strengthening exercises. Strength training is done to build up muscle tissue. It typically consists of graded exercises involving resistance training. Strength training may be high or moderate in intensity. Resistance training has been acknowledged as an effective method to improve muscular strength, power, and hypertrophy, which are fundamental components of physical fitness related to the quality of life. For adults of all ages, the goals of a health-related resistance training program should be to make activities of daily living, example, stair climbing or carrying a grocery bag, less stressful physiologically and effectively manage and even prevent chronic disease and health conditions such as osteoporosis, type 2 diabetes, and obesity. For these reasons, although resistance training is important across the age span, it is most important with age. Flexibility exercise. Flexibility training, slowed, controlled exercise performed in a gradual manner, usually in an increment of 15 to 30 seconds, that aid in the range of movements at joints or series of joints. Three main types exist. This includes static, dynamic, and PNF, which is proprioceptive neuromuscular facilitation. Static involves held positions that are effective with little required in terms of assistance and time. Dynamic involves repetitive bouncing movements that produce muscle stretch over time. And PNF involves alternating contraction and relaxation of agonist, antagonist muscles at specific joints that generally produce the largest increase in flexibility. In conclusion, there is strong evidence that aerobic exercise conducted 20 to 40 minutes, 3 to 5 days per week is beneficial for enhancing aerobic fitness, walking speed, and walking endurance in people who have had mild to moderate stroke and are deemed to have low cardiovascular risk with exercise after proper screening assessments. Thank you.
Thank you very much, Riona, for your wonderful presentation. And I'm hoping that the audience who have listened to Riona will surely be motivated to move a little bit more, because physical exercise is one of the pillars of healthy lifestyle, and you must attain that healthy life goal today. Move more and keep your heart healthy. Thank you very much, Riona. So we'll hear more from Riona during the question answer session, but now I'd like to call upon our next speaker now. For those who joined a bit late, there's a bit of change in the agenda, and it's not me as the second presenter, it's Hadil. So I would like to welcome Hadil Saad. So Hadil Saad is a certified nutritionist with a bachelor's degree in nutrition and food technology from Jordanian University of Science and Technology. She has specialized in weight management program and post-bariatric surgery nutrition and weight management. You will be pleased to know that Hadil writes not for one, not for two, but for 3 medical newspapers of Bahrain and Saudi Arabia. Is that not commendable? She is a healthcare advisor and founder of healthcare units in various financial sectors in Bahrain. This evening, Hadil is going to talk about heart healthy eating. Welcome, Hadil, and over to you.
Thank you, Doctor, for this introduction, and welcome everyone. Actually, I'm very happy to be with you on this occasion, and allow me to share my screen.
Yeah, we can see it, Hadil.
Yeah, just start. I need 1 minute. I try to move it from the beginning so we can start from the beginning of the information. First, thank you very much for all the information you give us, girl, and thank you, doctor, for this opportunity that you give it to me second time. Last year also was an amazing webinar. Thank you very much for this opportunity. Actually, as you notice, that all the information or everything related to our heart or our health of our heart is related to what we eat. So usually what we eat is what is our body. So today we will speak about heart healthy eating, and there is some tips. I put it the general tips usually that to reduce stress, to drink less, also to reduce salt or sodium. We have to cut fat, to be more active, as my colleagues said, you have to lose weight, very important, and to lower our blood pressure. We should have good sleep from 6 to 8 hours daily, and to do exercise like lifting some weight. And we have to stop smoking, reduce smoking until we can stop smoking, because all these things can affect negatively on our health of our heart, and it's increase the risk of the cardiovascular disease. So, and this World Heart Day, as we mentioned before, that the heart disease is one of the first causes of death in the world, and the cardiovascular disease also the first cause of death in women. So I'm sad to say that, but every 3 women have at least one of them have heart disease. So why? All this because of stress, age, also because of lack of exercise, have a high calories diet, and most of women, they don't have time to take care of themselves. So this year, I want you all to connect with yourself and with others to get your time to take care about your diet, about your life, about yourself, and about your heart. So there is many healthy tips, and there is many people say they do this, do that, but sometimes with our fast life now and how we control our life, how we control our food, I find for you the easiest steps and the fastest steps can help us to reduce the risk of cardiovascular disease and the risk of heart illness. So a healthy heart, how? All these tips, let's say 8 tips, we will go through it, okay? And one by one, I will give you all the information how to follow. So we have to control your portion size. We have to eat more fruit and vegetables. We have to select also whole grains. Why? How we limit our unhealthy fats, how we choose low-fat protein sources, and to reduce our sodium in food. How can I see how much sodium or how much salt in my food? So do plan. Imagine that you are the dietitian of yourself. You have to create your daily menus as well. You have to make food record to protect your heart. Allow yourself an occasional treat. Very important to give yourself free meal weekly or free day. This can help you to reduce stress and to increase your metabolic rate within the week. So why heart healthy eating important? Heart healthy eating along with regular exercise. It's not enough to eat healthy. Very important to have regular exercise with physical activities. This can lower your risk of heart disease and stroke. And very important to drink plenty amount of water, especially in summer. This can reduce also the risk of heart disease. How I control my portion size, how much you eat is just as important as what are you eating. So overloading your plate, taking seconds with eating and eating until you feel stuffed, all these can lead to eating more calories. More calories mean that you should eat. So when we go any restaurants, we notice that the portion served is often more than anyone needs. So we have to control this also when we go outside of the house, not all, inside our houses or inside our work. So also in the restaurants. So there is few simple steps to control food portion size can help you shape up your diet as well as your heart and waistline, which is in the middle of your body. The waistline is very risky on the heart and heart disease. It makes pressure in your heart. So how can I do all this? Use a small plate or bowl when you eat, reduce the amount of food. This can help you to control your portion size. Eat more low calories. How can I eat low calories, more low calories? I have to choose the nutrient rich food, and I have to choose fruit and vegetables. These give me fullness, and in the same time, it's low calories. Eat smaller amount of high calories, like high sodium food, such as refined, processed, or fast food. How to control your serving size? It's just the skills, and it depends on the diet you are following. And when you do it more, you know how much your body need or how much your stomach can take. So all these tips can help you to reduce the amount of the food, the serving size, the portion size. It's not just about calories. Most of the people ask us that, how much calories I have to eat per day? You can eat food, but reduce the portion size of the food. So eat more vegetables and fruits. Why? Vegetables and fruit are good sources of vitamins and minerals. Vegetables and fruit are also low in calories and rich in dietary fibers. What is dietary fibers? How help us fibers? Fibers give me fullness, so I will not eat more. So vegetables and fruit, like other plants or plant-based food, contain substances that may help prevent cardiovascular disease as well. Eating more fruit and vegetable may help you cut back on higher calories food, such as meat, cheese, snack food, because it gives you satisfaction, as I told you before. So fruit and vegetables, what I have to choose and what I have to limit. Some people know how I limit the fruit and vegetable. It's very important, but I should not stop, but I have to reduce the amount. So fresh or frozen vegetable and fruit is good. Low sodium canned vegetable is good. Canned fruit packed in juice or water are good. Also, all the fresh kind are good. Fruit and vegetables to limit, like coconut, vegetable with creamy sauce, fried or breaded vegetables, canned fruit packed in heavy syrup, which is half sugar, frozen fruit with sugar added as well. So how I select whole grain and which is the best whole grain and why whole grain. Whole grain are good source of fiber and other nutrients that play a role in regulating blood pressure and heart rate. Many studies show that. You can increase the amount of whole grain in heart healthy diet by making simple substitution for refined grains products, or sometimes try to go for whole grains such as whole grain, quinoa or barley. Here's some grain product to choose and grain product to limit. All of us know that the whole wheat flour is good. Everything whole grain breaded, all these 100% whole wheat is very good for our health. High fiber cereals with 5 grams or more fiber in a 1 serving size. Whole grains such as brown rice, barley, also whole grain pasta. So we notice that all whole grain. Oatmeal as well is a good choice. White refined flour without grain, which is not healthy, we have to limit or sometimes avoid if we have any problem with them. White bread, muffins, frozen waffles, all these donuts, biscuits, we know these are sweets, and pies, egg noodles, all these we have to reduce or limit these or avoid these kind of foods, especially if you are obese or have overweight. So let's go for limit unhealthy fat. Actually, fat always the problem. They say fat, the biggest problems in life, causes the cardiovascular diseases, but there is good fat. Give us energy for life. It's important for our building ourselves and our bodies. So the fat, sometimes it's important for life. So we can't limit or we can't 100% avoid fat from all kind of food. And there is some diets now follow these things, which is not 100% right. I'm not with any kind of diet, avoid any kind of elements important for our body. So limiting how much saturated and trans fat you eat is an important step. Let's go back again. How much saturated and trans fat? It's very important to reduce your blood cholesterol and lower your risk of coronary artery disease. A high blood cholesterol level can lead to build-up blocks in our arteries, which can increase your risk of heart attack and stroke. And all these information in detail, I think it's with Dr. Raza. The American Heart Association offers these guidelines, as I put for you the saturated fat and the trans fat. there is how much include daily, how much the recommendation daily, less than 6% of total daily calories from our calories, which is if you are taking 2000 calorie daily, that's about 11 to 13 grams of fat. What about the trans fat? Trans fat avoided. Then someone will come and ask me, how can I find the trans fat, the unsaturated fat? It's long procedure. Only read the nutrition facts in the packets. This is easy, the easiest way to control your food. There are simple ways to cut back on saturated fat and trans fat. Trim fat from your meat, or choose lean meat with less than 10% of fat. Use less butter, margarine when cooking and serving. You also use low-fat substitution when possible for a healthy heart diet as well. For example, let me give you an example. What can I do daily? 2 pure baked potato with low sodium salsa or low-fat yogurt. The manufacturer information is very important, by the way. Rather than butter, I put some low fat or low salt, or use sliced whole fruits or low sugar fruits spread on your toast instead of margarine. This is good alternatives for our body. It's good. For long life, it's good. For long term, it's good. It will give me good side effects on our body, positive effect on our body. So there is which kind of fat we can use or choose. Fats to choose, fats to limit, and most of us know how much the olive oil, the canola oil, vegetables and nuts oil, margarine, trans fat free, cholesterol lowering margarine, nuts, seeds, avocados, all these good choose of fats, and we can choose them and use them. So also butter, lard, these things we have to limit. I will read it. Creamy sauce, bacon fat, lard, creamers. There is some kind of diet depend on high fat intake. So I want you to take care about these diet. Everybody have his own diet plan. So don't follow the diet in Google. Don't follow the diet on social media. It's not right for your body. You have to get your own dietitian to give you the best for your heart, the best for your body. So the coconut and palm oil, we have also to limit it. When you do use fat, choose monounsaturated fat, such as olive oil, as I told you before. Canola oil is good. Polyunsaturated fats found in certain fish, avocados, nuts, and seed also are good choice for a heart-healthy diet. When used in place of saturated fat, monounsaturated fat, and polyunsaturated fat, all these names you can find it in the nutrition facts on the products, by the way, may help lower your total blood cholesterol, but moderate is essential. Let's say this is the important thing. All types of fat are high calories. An easy way to add healthy fat and fiber to your diet is unused grounded flaxseed. I don't know if everybody familiar with flaxseed, but flaxseed are small brown seeds that are high in fiber and omega-3 fatty acid. Studies have shown that flaxseed lower unhealthy cholesterol level in some people. You can grind the flaxseed in coffee grinder or food processor, or you can use it with yogurt or with cereals. Here is some benefits of flaxseed oil also. It's a good alternative of fat, reduce cancer risk, promote heart health, improve skin, aids in weight loss also because it's giving me high fiber and fullness, reduce also the menopause symptoms. We will talk about low-fat protein sources, which is very important. How I choose this thing. Lean meat, poultry, and fish, low-fat dairy products, and egg are some of your best sources of protein. Choose lower-fat options such as skinless chicken breasts rather than fried chicken patties, and skim milk rather than whole milk. There is some people, they say it before, and we heard a lot that low fat, no fat, less 1% fat, all these are wrong. No, when you find something on the product and the nutrition facts mean that you can follow it. Use the nutrition facts in the packs. Fish is a good alternative to high fat meat But certain type of fish are rich in omega-3 fatty acid, which is, I told you before, that it's a good source of fat, good kind of fat for our brain, for our heart, for our body, which can lower blood fat called triglyceride. So omega-3 fatty acid, less triglyceride. You will find the highest amount of omega-3 fatty acid in cold water fish, such as salmon. Also, the flaxseed is the source of omega-3 fatty acid, walnut, soybean, and canola oil. Here, protein to choose and protein to limit or avoid. Don't avoid 100% the protein unless you have problems in your body about protein, that you can't digest protein, or you have any health or any illness regarding to the protein. Don't avoid it 100%. You can limit the protein. So protein to choose, low-fat dairy product, as I told you before. Eggs is good, fish, cold water fish, skinless poultry, legumes, soybeans and soy products like tofu and soy burgers, lean ground meat. Protein limited or avoid, if you need, full-fat milk and other dairy products. Let's say some kids need full-fat products, organ meats such as liver, fatty and marbled meat, hot dogs and sausages, and there is many studies now that it's lead to cancer. Bacon, fried or breaded meat. Lead to cancer means not the cause of the cancer, but in the long term, if I eat every day and a big amount of these kind of protein, it may cause the cancer or an cardiovascular disease. So reduce the salt or sodium in your food. Sodium or salt, eating too much salt can lead to high blood pressure, a risk factor for heart disease. Limit salt. Sodium is an important part of healthy diet. The American Heart Association recommends that, here I write for you, that healthy adults have no more than 2.300 milligram of sodium per day with a small teaspoon. I hope everybody following this. Most adults ideally have no more than 1.5 milligram of sodium per day. Also, reducing the amount of salt you added on the food table or while cooking is a good first step to reduce salt or sodium. Much of the salt you eat comes from canned or processed food, which is the hidden bad food. We have to know that, such as soups, baked goods, and frozen dinners. Eating fresh foods and making your own soups and stews can reduce the amount of salt you eat. So the last and not the least, reduce the salt and sodium. As I told you before, how we reduce the low sodium. We didn't finish. This is not the last, actually. This is some low salt items that you can choose. And there is high salt items you have to limit or avoid. Here, herbs and spices, salt-free seasoning blends, these good alternatives. Canned soup, reduced salt version of condiments, such as reduced salt soy sauce, and reduced salt and ketchup have also very high sodium. High salt items to limit or avoid: table salt, canned soup, and prepared foods such as frozen dinners. I don't have time, so I bring pizza every day, which is not right, frozen pizza. So tomato juice, condiments such as ketchup, mayonnaise, and soy sauce have a lot of salt, so we have to limit or avoid. Restaurants' meal have very high salt. So this is the last. Plan ahead or create. We will talk about the plan, how we will we will set or design our own menu, what can we do? And we will speak also about the free meal, which is all of you waiting for it. So I keep it in the end. Plan ahead, create daily menus. Actually, you know what food to feature in your heart healthy diet and which one to limit. Now it's time to put your plans into action. We have to do this action. After this seminar, we have to start being healthy, more healthy, to protect our heart from cardiovascular disease and to protect our family from this disease. Create daily menus using all the strategies I listed above. When selecting food for each meal and snacks, emphasize vegetables, fruits, whole grains, choose lean protein sources and healthy fat, limit salty food, watch your portion size, and variety of food in your menu choice is very important. So how I plan my menu depend on all above. Allow yourself an occasional treat all the 3 day. So allow to give yourself a free meal every now and then. A candy bar, let's say, or a handful of potato. These words make pain for me, but I will say it. Handful of potato chips won't affect badly or negative way in your heart healthy diet. Once a while, no problem. But don't let it turn into an excuse for giving up on your healthy eating plan. So we have to follow healthy eating plan if we need, or if we protect, even if we don't have problems or we don't have cardiovascular disease, we are not obese, we have to take care about our bodies and what we are eating. So incorporate these all tips into your life in line with exercise and drinks. As I told you before, good amount of water daily will reduce the risk of your heart disease effect, even if you are genetically exposed to these diseases. I have one quote I would like to share it with you. The best investment, everybody would like to do investment you have ever make is your own health. So I hope for all of you a very good health. And this is my Instagram page, and I will share with you also my email for any information. Also now you can follow me by Doctori app. This is application you can upload in your Android or iPhone. I have my clinic there. You can make appointment for weight loss or any inquiries you would like to share with me. Thank you for your listening. And I will go to Dr. Syed. Thank you, doctor.
Thank you very much, Hadil, for giving us an overview on heart healthy diet. And certainly what I liked from what you said is what we eat is our body. And I also understand that if you want to start to love your body, you've got to start hating food.
Yes.
So,
right.
So thank you very much for that.
Thank you.
And so please stay back if you can for the question answer session. And if not, then I think you have left your email address already. And so it's now my turn. So let me start sharing my screen and get started. Okay, so in the next 12 minutes or so, I'm going to speak about how you would recognize heart attacks and strokes, and how you would recognize the early signs and symptoms of heart attacks and strokes. I will briefly touch upon the risk factors for cardiovascular disease. I'm also going to talk a little bit about the cardiac screening as to how you can screen yourself just to see if you have any underlying heart disease. So cardiovascular disease, as you all know, includes heart attack, stroke, and something what we call peripheral vascular disease. So heart attack in medical terms is called myocardial infarction, in which there's blockage of the artery, one of the arteries or more. And once the artery gets clogged with a blood clot or it is blocked, it cuts off the blood supply to the heart muscle, leading to the death of the heart muscle. And this is what we call heart attack. Stroke, on the other hand, includes the blood vessels, to the neck, to the brain. And once the blood vessel to the brain is cut off or it is clogged with a blood clot, it will lead to lack of blood supply to a part of the brain tissue. And this is what we call ischemic stroke. And sometimes there will be, or there can be a rupture of the arteries or the blood vessels in your brain. And that will lead to what we call hemorrhagic stroke. But once there is a blockage of the artery in your legs or the arms or your neck, this is what we call peripheral vascular disease. it can, if it is not treated on time, this can obviously lead to damage to the peripheral tissue in your leg, arm, or it can also lead to stroke. Now, it is very important that you recognize heart attack as soon as it starts to happen. So the most common symptom of heart attack is chest pain. So this pain occurs in the chest, more commonly on the left side. Occasionally, it can also happen on the right. This pain can move upwards to the neck and can go to the jaw, but it certainly does not go above your lower teeth. So if you have any pain above that, it's not heart attack. This heart pain actually also travels down, and it can go down up to your tummy, up to the navel or the belly button. And if you get any pain that is below the belly button, then again, this is not heart attack. In addition, patients may have symptoms of breathlessness, and both chest pain and breathlessness are commonly seen when you start to exert yourself. Say, for example, when you're climbing stairs or you're walking uphill. In addition, patients may also experience some amount of sweating. Now, women are a little bit different when it comes to presentation or symptoms of chest pain. They may have symptoms like fatigue or tiredness. They may feel a bit dizzy, and they may feel nausea. So these are symptoms that are called the atypical symptoms, and that are more commonly seen with women than men. Now, how do you identify stroke? Now, stroke is recognized by acronym called FAST. And as you can see here, F-A-S-T, where F stands for face. And when I say face, the earliest sign of stroke is that your face either droops or it becomes asymmetrical. So it's not in the right order. There's some asymmetry in the face. A stands for arm. The arm becomes weak. And if you are holding something in your hand, the grip becomes weak and you may start to drop things easily. And you may not be able to raise your arm if you're asked to do so. S stands for speech. The speech becomes ununderstandable. It becomes slurred, and there is difficulty in speaking words or sentences. And T stands for time. So when somebody is having a stroke, definitely time is important. Time is brain. If you lose time, you're going to lose brain, part of the brain, and sometimes even it can cause a permanent damage, and you may lose the function of the brain permanently, and this will lead to irreversible damage. So when you see FAST, you must be quick with the T. So call for emergency medical help as soon as possible. You have recognized the early signs of stroke. Now, what you see on the slide, these are some of the traditional risk factors for heart attack and stroke or cardiovascular disease. High blood pressure or hypertension is one of the commonest risk factors for heart attack as well as stroke. It is also called silent disease or silent killer. And why is it called silent disease or silent killer? Is because you do not get any symptoms if you have high blood pressure. Majority of the patients, the high blood pressure or hypertension is detected when they go for a routine check and they find that their blood pressure is high. Some of the patients are in a denial and they would deny that, doctor, check my blood pressure again. Your instrument may be wrong, or I have had a busy day, I've got a headache and so on. So the readings may be wrong. That may be correct, but once the blood pressure is checked repeatedly and the blood pressure is still high, then that is the time you have got to accept the diagnosis of high blood pressure. And at the same time, you must follow the advice of the doctor, starting with the adopting healthy lifestyle. And if you are prescribed any medication for the high blood pressure, then please religiously take those. Obesity is the root cause of all medical problems. So obesity leads to increased risk of diabetes. It increases the risk of high blood pressure, high cholesterol, particularly the bad cholesterol. It also leads to problems, acidity. It leads to knee joint problems and depression and so on. But what is important is the obesity called the truncal obesity, where all the fat is deposited around your lower belly and your waist. So that is important. It is not the body weight that is more important. And some of you may know body mass index. That depends very much on your muscle weight. It depends on your bone weight, your water content. It also depends on your body frame. It depends on your height. So please do not be focused only on your weight. So it is the obesity, the truncal obesity and the belly fat that you should be focused on. In addition, there is something called visceral fat. Now, what is visceral fat? So visceral fat is essentially the fat that is deposited around your internal organs, around the liver, around the pancreas. So that is really bad. That increases your risk of you having a heart attack and stroke significantly. And how do you find those? You can detect by using special scans like PET scan or MRI scan. And there are some gadgets which can calculate your fat percentage, and it actually also tells you as to which areas of your body has got the highest amount of fat. And I would quote here that it is very well said that higher or longer your belt, shorter will be your life. So try to shorten your belt. I'm sure you will lead a longer life. Now moving on to cholesterol. So cholesterol, mainly there are two types. One is bad cholesterol called LDL, low density lipoprotein cholesterol. And there is HDL, which is high density lipoprotein cholesterol. So the LDL is the bad cholesterol and HDL is a good cholesterol. So what you're going to do, you're going to reduce your bad cholesterol and you're going to raise your good cholesterol. And how you're going to do it? The bad cholesterol you can reduce by obviously eating less of fatty, fried food, oily food, which Hadil has just mentioned. And what is the way to increase your good cholesterol? You can do it again by doing lots and lots of cardiac exercises, eating a lot of oily fish, some nuts, and there are a few medications that can help to increase your good cholesterol, but these medications have side effects, and so we generally do not prescribe. There are also medicines to reduce your bad cholesterol. These are called statins. Unfortunately, it has received a bad name for nothing, but certainly if you are given statins by a doctor, then certainly do not ignore it. Please take this religiously. If the cholesterol is very, very high, bad cholesterol is very, very high, then there are also some injections that can be given every 2 weeks or once a month to reduce your cholesterol. These are very powerful injections to reduce your bad cholesterol. Sedentary lifestyle certainly, again, causes a lot of health issues. It can lead to high blood pressure, diabetes, and obviously it's also a cause for psychological disorders. And certainly you are at ease and you would eat and drink, and that is not going to make things any better. Now, I'm not going to touch upon the diet part that has already been covered by Hadil in depth. Now, what about stress? So stress is very recently or more recently recognized as one of the important risk factors for heart attack and stroke. Now, there are two types of stress. One is chronic stress and the other one is called acute stress. So chronic stress is something that one would live for months and years together. And this will lead to a constant but definite damage to the inner lining of your heart arteries and your brain arteries. It does it because of the release of some chemicals or hormones. And mostly these are the stress hormones that are detrimental to your heart and your brain health. The acute stress is something that happens with a spur of the moment. You may be normal and suddenly there is a situation where you become very, very stressful. And this is not in all, but in few individuals, this can lead to rupture of the plaque. So plaque is something that is inside your heart arteries that can rupture and can release the blood clot that is present inside the cap of that plaque. And once it blocks your heart arteries, obviously it will block the blood supply to your heart or brain tissue, as well as the oxygen, and can lead to heart attack and stroke. Now, what you see here is diabetes and smoking. Now, diabetes and smoking, these are the two strongest risk factors for heart attack and stroke. Now, if somebody has got diabetes, then his or her risk of having a heart attack doubles. You are twice as likely to have heart attack or stroke if you have diabetes compared to someone who does not have diabetes. Similarly, if you are a smoker, then your risk of having heart attack or stroke doubles again. But if you are diabetic and you also smoke, and you smoke heavily, then your risk of heart attack and stroke actually quadruples. It becomes 4 times than people who do not smoke and do not have diabetes. Now, one question I ask my patients often, and I also ask my audience when I'm giving a talk like this, as to which one you think is more harmful. Is it cigarette smoking or is it shisha smoking? Now, shisha smoking, as you all know, has become a lifestyle for the youngsters. It has become a fashion for teenagers. And many think that the shisha smoking is a more healthy way of smoking, and certainly does not have many deleterious or ill health effects. Now, the reality is 1 hour of shisha smoking equals to at least smoking 100 cigarettes. Yes, I repeat that again. If there are any shisha smokers who are listening, please listen this again, that if you smoke shisha for 1 hour, then you are smoking at least 100 cigarettes. Yes, at least 100 cigarettes. And there are chemicals that are very harmful. And these are the chemicals which nobody will tell you, and it is never written on the package of the shisha ingredients. And there's a lot of commercial values that are attached for shisha smoking. So certainly be careful that shisha smoking is not a healthy option. But the biggest risk factor, I say, is ignorance. Yes, ignorance is the biggest risk factor for causing heart attack and stroke. If you are ignorant about your health, if you're ignorant that you have a disease which you are not sure about, or if you have not detected it yet, if you are ignorant that you have underlying heart condition, if you are ignorant that you have a heart condition and you do not seek opinion from the right person, you do not take the right advice, then certainly that is the biggest risk factor. Because heart attack, as I said, is a biggest killer, heart attack and stroke, which is cardiovascular disease, is a biggest killer, and it kills more than 18 million people every year all across the globe. But when you are seeking information, then you have got to seek that from the right sources. So seek the information, take the advice from your doctors, from general practitioners, physicians, or cardiologists. And please, please do not see Dr. Google before you see the real doctor. Because if you see Dr. Google and you get the wrong information, you will be misinformed. At the same time, the advice that you follow will not only be deleterious to your health, but it can also be misleading, and it can risk your health as well as your life. Here I have put few healthy heart goals that I'm just going to discuss in the next couple of slides. Again, I'm not going to touch upon, a lot has been already said on the dietary advice. Also, I'm not going to touch more on the exercise, but only I would like to say that you have got to exercise regularly. And World Health Organization recommends that you should exercise at least 5 times a day for 30 minutes, 30 minutes a day, at least 5 times a day, 5 days a week. So 30 minutes a day, 5 days a week, that's what you should exercise. And also WHO recommends that you should exercise for 150 minutes on an average, and you should do moderate intensity exercise per week, 150 minutes of moderate intensity exercise per week. Now you may ask, what is moderate intensity exercise? So moderate intensity exercise is that exercise where you exercise and you can still speak a couple of sentences. So you're still able to speak a couple of sentences, and that is moderate intensity exercise. If you are a smoker or if you drink alcohol, then please reduce the amount you smoke or drink, or you cut them off completely, or stop smoking and stop drinking completely. We all know the last 18 months or so has been terrible for us. We have all been under stress due to this COVID pandemic. We have not seen some friends for ages together. We've not seen a few family members or loved ones. Now, certainly that has created a lot of stress in our life. Now, there's nobody immune to stress. Everybody is stressed. I'm stressed. Perhaps in the audience, everybody has experienced stress, but there's different threshold of stress for everyone, and everybody is different. But the most important thing is that we must learn how to control that stress. So if you have a lot of work and if you're stressed about your work, if you have a lot of work at home and you're not able to juggle around between your work life and your personal life, then certainly you must learn time management. Yes, you must learn time management. At the same time, you must know how to delegate work to others, not take everything on yourself. At the same time, if you feel that you're not able to achieve something, no matter how hard you've tried and tried, yes, we say that, try harder, never give up. At the end, you will achieve. But life does not work like that. Sometimes things may be impossible beyond your capacity. And that is the time when you are overstressed, then you have got to let go. Yes, you must learn to let go of few things. And that is going to de-stress you and probably make you much happier. We all have got the duties to work. We have our responsibilities to our families, but we have also got responsibility. I would say we have got the right to enjoy ourselves, to enjoy that happy moment, to enjoy those occasions, the joyous occasions, to participate in some leisure activities, take some holidays, travel, read books, enjoy music, and so on. The best way to de-stress yourself, in my opinion, is to exercise. Yes, exercise, utilize the most of your time and exercise, and certainly that is going to relieve your stress. And also include in your exercise, I think Bhavanita has already mentioned that yoga is one of the best form of exercises, and deep breathing at the same time is going to de-stress you. And obviously it is very healthy for your heart. If you have conditions like high blood pressure, diabetes, anxiety, depression, then certainly first it should be diagnosed and it should be treated well, managed well, and should be brought under control. Now, in the community, there are different types of people of different ages, different strata, different race, different religion. But let me tell you, until and unless you have investigated yourself, unless you have screened yourself for any underlying illness, you cannot be sure that you do not have any health problem. So what is your first steps? So your first steps are that you should get yourself screened for any underlying heart condition or any underlying medical problems like high blood pressure and diabetes, if you're not sure about it. Because heart attack and stroke, as I said, is deadly, but the good news is that 80% of the heart attacks and strokes are actually preventable. Yes, 80% of the heart attacks and strokes are preventable. And how we can prevent? We can prevent by doing quick screening. To prevent heart attack, we follow what is called cardiac screening. Cardiac screening is very simple. It takes a few minutes of a consultation with your doctor, maybe a general practitioner, a physician, or a cardiologist, where the doctor is going to ask you for a few questions about your symptoms that may be indicative of any underlying heart problem. We'll also ask about some medical condition. And then you go on to do a 12-lead ECG or electrocardiogram, which is just a tracing of electrical activity of your heart, which you can see here. And this may give some indication if you have underlying heart problem or if you are at risk of developing a heart attack in the future. We also do a heart scan. It is just like an ultrasound of the heart, which we call echocardiogram. And the whole idea here is to look at the structure of the heart. We also look at as to how your heart is pumping, and if all the walls of the main chamber of the heart, they are pumping well and they are pumping in a coordinated fashion. If they are not, then that itself is an indirect evidence that there may be a blockage or obstruction in one of the heart arteries. After this, we may proceed to what we call stress testing. We can do treadmill stress testing, which is most commonly available in most hospitals. And here a person walks like on any treadmill, but there's a fixed there are different stages where the speed changes. It increases every 3 minutes, and the inclination of the machine also increases every 3 minutes. So essentially, the workout or the exercise becomes harder and harder. And while the person is exercising on the treadmill, we take continuous ECG tracing just to see if there are any changes on the ECG while somebody is under stress or while somebody is exercising, because these changes may not be visible at rest, but they may be visible once the person starts to exercise. What you see here is again a picture of showing an ultrasound of your neck vessel. So this can pick up by ultrasound if there's any flaring of your inner lining of the artery, or if there's any blockage. And again, in the left bottom corner, this is a picture of cardiac CT scan. So this scan is a screening tool that picks up calcium deposits in your heart arteries. And more the calcium deposits, worse is your risk of developing a future heart attack. So this is called calcium scoring, and it is done by a CT scan. Now, one thing many people are a little bit confused and they are not sure the difference between heart attack and a cardiac arrest. Now you'll find on television, in newspapers, people referring to that somebody collapsed and this person died of heart attack. Now this may not be entirely true, because if a person collapses, this is not may not be heart attack, this probably is a cardiac arrest. So the major difference between heart attack and stroke is, of course, I have said all about the heart attack, the chest pain and other symptoms. But in heart attack, the person rarely loses consciousness, rarely becomes unconscious or collapses. But the heart attack can lead to cardiac arrest when there is abnormal electrical activity in the heart. And this is called cardiac arrest. So cardiac arrest essentially is the electrical malformation. It is something to do with your abnormal electricity in the heart. When there is abnormal electricity, the heart starts to pump or starts to cure and does not pump in a coordinated manner and does not have the efficiency to pump enough blood and oxygen to the brain. And once the brain does not get enough oxygen, the person loses consciousness and collapses on the ground. Now, once you find someone who is on the ground, first thing you need to do is to shake the person by the shoulder, not the neck or the head, and just to see the response if the person makes any effort to respond or not. If the person is not responding, that gives you a clue that the patient has had a cardiac arrest. Then if you know how to find the pulse, you can feel the pulse and also see if the person is breathing. If none is happening, then certainly this patient had or the person has cardiac arrest or cardiopulmonary arrest. Without wasting time, you have got to call for help immediately, because that is important. As I said in the beginning, time is brain, time is heart. If you lose time, then the person is going to lose the functions of the heart or the brain permanently, almost permanently. And it is said that if somebody has a cardiac arrest and if the medical help does not arrive within 10 minutes, then the chance of survival is 0. And your chance of survival decreases by 10% every 1 minute. So in 10 minutes, if the help does not arrive, then your chances of survival is almost 0. And if people are trained in the basic life support, and this involves some skills to press on the chest that can pump blood to the brain, and at the same time, you can give artificial oxygen. And what you see here, a red color tool, which is called AED or automated external defibrillator. Now again, this is not very difficult to operate, and this will be installed in most public areas in most countries now. If somebody has got a cardiac arrest, if there's any electrical malformation, you just press the button where you can see in the picture, that button is pressed, and it will give you automated prompt to do what you need to do next, and the machine will give the shock if it is appropriately advised to do so. So finally, I would finish with that the World Heart Day, we have got a duty, we have got a responsibility to increase awareness of heart disease, to recognize heart disease early, to detect heart disease early, and to screen yourself for any underlying heart condition or underlying risk that may lead to stroke or heart attacks. So with that, I thank you very much. And next, I would, first of all, let me stop sharing. Okay, thank you very much, audience, for your patient listening. And if I may request the presenters, Hadil, if you're still there, yes, thank you very much. And Riona, if you're there, please put on your camera, Riona.
My camera is not working, actually. I don't know what happened.
No, yours is working, Hadil, yours is working. Riona's is not working. I can't see Riona yet.
My camera is working?
Yes, I can see you. So let me see if there's any question in the chat box first. So I think this question is to Hadil, the first question.
Yeah.
What if we mix flaxseed, pumpkin, cucumber, watermelon, chia seed, sesame, sunflower seed with mixed berries and then eat in the form of smoothie with milk? Is there any adverse effect of combination of all seeds at the same time?
Actually, I give him the answer because I was going to leave, but I will also say the answer in front of everybody. There is no problem to mix the seeds on your health. It will not harm your health. But if you are fasting for like 16 hours and then you are mixing all these seeds, this may affect on your digestion system. It will make load in your colon and may cause bloating in your stomach for a lot of seeds, because the digestion will be not easy to digest all kind of very high fiber. So it's not it will not affect very badly in your health. But I prefer if you take every seed alone, to take the benefit individually of every seeds, and every seed have its own amount of water intake. So you have to take amount of water so you can digest these seeds. So I prefer if you take every seed alone to take the good benefits from the seeds.
Thank you, Hadil, for that. Now I can see Hanadeep raising hand. Hanadeep, you can unmute yourself. You may also turn on your camera if you like. And please go ahead, ask your question. Hanadeep.
Assalamu alaikum, Dr. Saad.
Alaikum assalam. Hello.
Salam.
Yeah, I am Babu Khan. I want to ask one question. In Bahrain, in general health center, like government health center, we want to go for checkup, like general checkup. This facility is available like our public health centers. We can go and can screening and these things.
Okay, so the question is to me, I understand. Dr. Babu Khan,
Yeah.
first of all, welcome here.
Yeah.
Yes, you will not get, if you are talking about the heart health checkup, then I do not think you will get that in primary health centers.
Yes.
So you have got to go to a specialized center, and where they have a cardiology department. Obviously, they need to have all the means to do all the tests that are required for a heart checkup. So not in primary health centers, but specialized centers. Yes, certainly they will have all the facilities.
Thank you so much, Doctor. Thank you.
Thank you. Thank you. Okay, there are some questions in the chat box, so let me go through this. So I think this is again for Hadil. Instead of using sodium salt, can we use potassium-rich salt to reduce heart disease?
As I said before, moderate. Everything in moderate. We need calcium, we need sodium, we need potassium, we need all these elements for our body. So we can't take something instead of something. We have to reduce, limit sodium, and we have to also limit the potassium, because some people, they have problems to some elements. So usually we have to moderate all kind of elements because we need it all for our body. We should not avoid any elements in our body because there is sodium, potassium in our cells working. So we have to moderate always to take both elements.
Okay, thank you, Hadil. I think the next question is for me. What is the difference between CT angiography and conventional angiography? And is CT angiography is a reliable diagnostic tool? So thank you very much for that. That's a good question to ask. So the conventional angiography, I believe what Mr. Irshad Farooq means is the catheter coronary angiography. So there are two types of angiography for the heart. One is done with the use of a CT scan, and the other one is done using catheter, which is called the catheter coronary angiogram. Now, the basic difference is that the CT coronary angiography is a non-invasive procedure where you go inside a CT scanner and a dye is injected in one of your arm veins, and you can see the pictures on the computer screen, and that's it. And this takes hardly 10 to 15 minutes. Modern machines even less than that. But the catheter coronary angiogram, the catheter usually goes through your artery. It's not a vein, it's an artery, where the catheter goes from your forearm artery and goes all the way to your heart artery, one of your heart arteries. And then the dye is injected, and then we can take pictures of these heart arteries. And obviously, the catheter coronary angiogram is an invasive procedure. There are more risks involved. Some damages may happen, although the risk is small, but the complications do happen. So this is the major difference. Now, the gold standard, if you ask, for diagnosing occlusion of heart arteries is catheter coronary angiogram, not CT scan. CT scan will tell you at least 95, 97%. But if you want to find out if there is any blockage and you don't want to look at the whole anatomy of the arteries, then it has to be catheter coronary angiogram. Okay. I'm seeing the list of questions, more of compliments. I'm just scrolling through these. So the next question is, my friend is 23 years old. He's having slight rise in blood pressure than compared to normal. Now, this is probably a very practical question. Now, as you see, 23 years old is a very young person, have blood pressure at a young age. Now, I did not touch upon this subject, but this is important to discuss, that if somebody develops blood pressure at a young age, particularly less than 30 years of age, then we need to look for the secondary causes of hypertension or blood pressure. When I say secondary causes, there could be a problem with the hormones, there could be a problem in the kidneys, and there could be some other problems in the arteries. So they have to be investigated thoroughly. And if we find an underlying cause for blood pressure, then we should aim not to give tablets, but to treat the underlying cause. And once you treat the underlying cause, then this blood pressure is treated and you do not require to take any medicines. So 23 years old, now the question is slight rise. Now let me tell you that if there's underlying cause, then the blood pressure is not slight rise. If there's a severe rise in blood pressure, which are difficult to control with a combination of tablets, we may give even 5, 6 types of tablets, even the blood pressure will not be controlled. So that is the major difference of blood pressure of young individuals. Okay, again, the next question is explain that the shisha is more dangerous than smoking cigarettes. So vaping is very popular nowadays. please advise the impact and risk. Again, it's a very practical question. We see lots and lots of people, they are moving to vaping. They are away from cigarette smoking, away from shisha, but they have started to vape only with the pretext that they think that vaping is a safer option or a more healthier option compared to shisha or cigarette smoking. But this may not be entirely true. And I say that at the moment there is little evidence that vaping is safe. This is again a very controversial subject. Some papers initially said that vaping is safe. It also allows you to give up smoking or quit smoking. But a recent paper that was presented in the American Heart Association has clearly mentioned that vaping is equally bad as cigarette smoking and can lead to injurious health effects. It may not be immediate, but over a period of time, it can be very harmful. So there are still early days to talk more on vaping on the safety aspect, but the early warning signs are that it is not very safe as it was initially supposed to be or was thought to be. When do you refer a patient to do CT angiography? Yes, CT angiography usually is reserved for patient. Now, heart patients, when they are risk stratified, which meaning by which if you are risk stratifying a patient to see what is the risk of somebody developing heart attack in 5 years or 10 years time. So we put them into 3 categories: low risk, intermediate risk, and high risk. So low risk, obviously, these are the people who are at very low risk of developing heart attack or stroke in the future. And the risk is usually less than 7.5% or less than 5%. But if the risk is between 7.5% and 10 to 15%, then this is the intermediate risk of developing heart attack, stroke in next 10 years. And if the individuals fall in that risk, intermediate risk, then these are the people who should be referred for CT coronary angiography. At the same time, if you feel that either stress testing, like the example I gave you, treadmill stress testing, is inconclusive, or if somebody is not able to do a stress test, then these patients can be referred directly for CT angiography. Is there any side effect of taking supplement, calcium tablet, if required to be taken? No, I'm not sure if this question is to me or to Hadil, but I suppose it's for me because I've discussed the calcium deposits on the heart arteries. And then no, because whenever you take calcium, again, don't take in excessive amount. But if somebody takes calcium in prescribed quantity or prescribed amount, then certainly this is not going to be harmful because your kidney and bowel have got the capacity to excrete this calcium from your system unless you overload yourself with calcium. So do not be afraid that these are going to be directly deposited in your heart arteries. No, it's not like that. While on asking his daily lifestyle to work at night to early morning and sleep at morning, whether his lifestyle responsible. Yeah, I think what the question means that if somebody has got a lifestyle where the person is working shifts, if I understand that correctly, a person may be working during the evening and maybe working during the daytime. So this is very commonly seen in people who work shifts. So they do not have a fixed routine. And this is a major problem. And this is indeed a health risk for everything. One, the dietary pattern is very much upset. Person does not have a fixed routine to eat. And if the person eats, then shortly the person, or very often they go off to sleep, which is certainly bad for health. And certainly these people, they gain a lot of weight and develop a lot of health issues. And so yes, this is an issue. And of course, they do not find a time and they do not fit in a routine where they can exercise enough. So thank you for that. Do you recommend heart patient to travel long distance alone? Again, depends on what the long distance will be and depends on how severe the heart and what the heart condition is. If the heart attack is fresh and has been a big heart attack, then certainly not. This patient should not travel alone. they must have somebody accompanied because you never know what the complications may occur. But the stable heart patients, yes, they can travel alone and they can travel long distances. I see there are a lot of questions directed to me, but in the meantime, has anybody got question for Bhavnita and Hadil or Riona? Because obviously I don't want to keep Bhavnita for a long time because it's already late in India. So if you want to unmute yourself, please feel free, get all the yoga tips from Bhavnita while she is here. So you can turn on your camera, you can unmute yourself. Please go ahead and ask a question. You can take a yoga tip for free from her while she is here. So while you are thinking about your questions, let me read the next question. But please come back to Bhavnita because she's a special guest for us all the way from Mumbai, India. What is the maximum heartbeat? What level of maximum heartbeat are okay when we do severe exercise or fast walking? Now, this is again a very practical question. Obviously, we take heart rate into account when we are exercising. So how the heart rate or the comfortable heart rate at which you should exercise or the safe zone. And also we find that the most beneficial zone of heart rates are, you should remember a few figures, 220 minus your age. So if you are 40 years of age, then 220 minus your age 40 is 180. So you should aim for a heart rate which is maximum at 180. You may go beyond it, but it is recommended that you should not go beyond it for a continuous amount of time, because this number one can easily make you fatigue, may make you feel dizzy, but at the same time you do not get much of the benefit of the exercise if you're trying to burn calories and you're trying to remain yourself active. So 220 minus 40, that's the maximum. But the range is between 65% and 85% of the maximum heart rate. So 65% to 85% of 180. That's the range where you're going to get maximum benefit if you're trying to burn calories. If a patient with coronary artery disease, he is implanted stent. After a few years later, he has complications on the stent area. He is implanted. He is fear on bypass surgery, then which step need to be taken? Yes, this is again a very practical and very common scenario that we see. If somebody had a bypass surgery, then certainly having another bypass surgery is a risky business. It puts the person or the patient under lots of complications because it means that, bypass surgery means opening or cutting the chest and then opening and taking out the heart and doing surgery on it. And if another surgery is to be done, then obviously you're opening the chest again. And then there are a lot of changes that take place around the arteries on the heart, and this can lead to complications. So the safer option is that, yes, you can place stents if the arteries are suitable for putting stent, but there are circumstances when you cannot put stents. So arteries are such you cannot put stents. Under those circumstances, you need to have another surgery, but this will be a high-risk surgery. You have to sign a high-risk consent and then undergo another bypass surgery. Okay, there is a question. I'm 33 years old. I recently diagnosed with hypertension, that to 180 by 110, which is quite high blood pressure. Visited doctor, underwent KUB, which is kidney, ureter, bladder sonography, and color Doppler. 24 urine VMA tests, both are normal. Advise some antihypertensive. Then any other test should I do? My lipid profile is normal. So I can give you a broad outline. Obviously, this is not a platform to do a medical consultation, which will be unethical for me, but I can just give you a blanket advice or a broad advice. So 33 years old and your blood pressure is very high. So one thing I would say to the person who's asking this question is that you're still young. and your blood pressure being so high, I think first and foremost, you need to go thorough investigation to see if there is any underlying cause for high blood pressure. One thing you have mentioned that your kidneys and color Doppler, they're normal, perfect. That is one thing ought, that you do not have underlying kidney disease. And VMA, again, these are the hormones that are checked. Again, this excludes a lot of hormone issues, but there are a few other hormones and a few other tests that need to be done. So please consult your doctor or cardiologist, get these tests done first. And certainly I'll not be in a position to advise you medication here. So you have to consult your local doctor, but I would advise that please get yourself thoroughly checked up before any treatment is advised. At the same time, remember, you have got to follow a healthy lifestyle, reduce your weight if you're overweight, eat healthily, and exercise regularly. Should all people above the age of 50 take aspirin? No, certainly not. This was an old concept that people who were above the age of 80 were advised aspirin. But right now, the recommendations are that we need to risk stratify the patients. And if you are risk of having, and the risk stratification is done by different parameters, we take into account your age, your sex, your risk factors like smoking, the underlying other medical condition, like if you have diabetes, high blood pressure, and so on. So we come up with a factor or a percentage. And if your risk of having a heart attack or stroke in next 10 years is 15% or more, then only we recommend aspirin. And so aspirin is not recommended for everybody because remember, it is now recently identified that the aspirin can lead to bleeding. So it is not recommended. Now there's a, okay, I think this is Bhavnita and just leaving her Instagram and her email address here. So before I move on, please, if somebody has got any question to Bhavnita, I don't want to hold her long. Please unmute yourself. Please turn on your camera and get a tip for free on any yoga, any topic you want to, any aspect of yoga you want to discuss with Bhavnita. Please feel free for that. Now going back to the questions again here, patient has diabetes or on treatment under control, no other problems, age 60, lipid profile normal. Does this patient has to take aspirin, family history of heart disease? Now looking at the risk factors which you have described here, patient is already diabetic. Now remember, diabetes is a very important risk factor, and sometimes we refer diabetes as heart attack equivalent, which means that it is like somebody who already had a heart attack. But taking into account that the patient also has family history as already 60, then yes, my guess is that yes, that person should be on aspirin, definitely. Family history is again when somebody in the family develops a heart attack less than 50 or 60 years of age, that's a positive family history. Sir, my friend is age 22 while on eating fatty meal. He is having a slight pain in the right chest. What tip that I have to follow to reduce this pain? Now again, it depends on what is the cause of the pain. 22 years age is quite a young age to develop heart attack, certainly, but it is not impossible. But I would guess that this may not be a heart attack. So it may be a gas pain or acidity or acid reflux. But certainly I cannot advise on this. You have got to see your local doctor and certainly take the appropriate advice from your local doctor. Now, finally, I get a question for Bhavnita. Bhavnita, you can unmute yourself. Please turn on your camera. Yoga to relieve stress. Any yoga for insomnia. So 2 types of yoga. Yoga to relieve stress and any yoga you want to recommend to relieve stress.
For releasing stress, one wonderful pranayama, the breathing technique is Anulom Vilom, or it is Nadi Shodhan, or you can just Google with the name alternate nostril breathing. But before doing any practice of yoga, just make sure that you do it under the guidance of a trained yoga teacher. I have seen so many people just watching Google and YouTube videos, it is not advisable for them because so many people have different conditions. Like what will be suitable to them or not, that only a yoga teacher will be able to tell. And for relieving stress, like I said, you can do any breathing exercises that are there in yoga that will definitely help you. And one most important thing is you have to be regular with your practice. Not just like it will cure your insomnia, you will have a better sleep, plus your internal organs will be healthy. We take care of cleansing the internal body with some kriyas, cleansing techniques, all these things together. And there are some postures also that help in increasing, like there is one question, in increasing oxygen level, there is a breathing, it is called diaphragmatic breathing or belly breathing. It has done wonders during this COVID period. Those who had COVID, those who were COVID positive, they were doing this breathing practice. Like you keep your hand on the belly, then you start to focus on your breath. Breath is the most important tool in yoga that you have to be all the time aware of. Just focus how it is your breathing and try to do deep breathing, because deep breathing has benefits of curing your body, healing, and improving your body's system, your performance. That will help you with proper functioning of the body, good oxygen levels, good sleep, and good body with strengthened muscles and internally also. If you feel like asking some postures, then just feel free to connect with me over call, or I just share the details. You can connect me over there and I'll be happy to answer in detail. And
Thank you,
elderly
thank you,
people,
Bhavnita. There is another question for you. How to increase oxygen level in elderly people by simple yoga exercises?
it is the belly breathing, or you can call it diaphragmatic breathing. It is just a simple technique. You just lie down, you keep your legs bent, and then keep your right hand on the abdomen, left arm down. With this, inhale, belly out, exhale, belly in. It will help you with increasing lung capacity also, because our lung capacity is almost 6 liters, and in regular life we almost use only 500 ml out of that. So we have to work on increasing that efficiency with deep breathing on belly. Why we keep the hands there? With the touch we'll be more aware and our mind will not wander, will not have any thoughts. With this awareness, your belly is rising up, is falling down. Keep the awareness there. It will help you with your sleep also. You will have a wonderful good night sleep. I have seen so many people, like someone was asking for hypertension. A boy, he is just 28. 5 months back, because of COVID, he lost his job, and so many stressful situations were going on in his house. After that, he Googled, and his doctor suggested that you should start practicing yoga. He's practicing with me for past 5 months now, and he has controlled his blood pressure levels, plus his cholesterol was almost 295, and the maximum should be like under 200. Now it is also reduced, it is under the limit now. And all these factors are prone to a heart disease, coronary disease. So with yoga practice, we can balance all these things, not just that we have mentioned today, beyond that also. Some people go through some hormonal changes like hypothyroidism. With yoga postures, there are some postures that will help in regulating the thyroid gland, plus releasing the necessary hormones. Plus, so many technical things also happen in a yoga session, and I explain them in detail so that whenever you are doing a yoga practice, you should be well aware of it, whatever you are doing. And rather than watching a YouTube video, I would just suggest don't practice, because doing wrong will not benefit you. Practice it under the guidance of a teacher. After that, you can become your own teacher. Just practice on your own. And everyone should do yoga every day or every alternate day.
Thank you for that.
I hope that will.
Bhavnita,
Thank you,
and I
Dr.
think
Raza.
that during the COVID pandemic, the people who have been affected, where the lungs have been affected, and deep breathing exercises certainly have become, has come very handy and helpful.
Yes.
Okay, thank you for that. And I think there are a few more questions. We'll just take a few of them before we close. So now there's one question about statins. So statins are necessary if the conditions demand, but what are the things that we can do to counter or alleviate the side effects of the medications? Yes, I think that's a very good question and a very practical one. Now, statins, now first let me tell you, ladies and gentlemen, that it is the most feared molecule, and I don't know why, because there's a lot of propaganda against statin than any other medicine that we know of. But the fact is, yes, statins can give side effects, but these side effects are extremely, extremely rare. So do not be afraid of taking statins if you are recommended statin, because statins have been proven beyond doubt that it protects you from having heart attack and stroke. And there's not 1, 2 studies, there are hundreds of studies that have proven this. Now, of course, there will be side effects. So what you can do is if you have side effect with one statin, either you can reduce the dose, you take the drug on alternate days, or we can switch you on to a different statin. One thing that we commonly do in practice is that we measure the vitamin D level, because we have seen that people who are deficient in vitamin D, they do not tolerate this statin very well. So you have got to measure your vitamin D, and then if you are deficient, then we give you vitamin D, and then you start to take statins. At the same time, there is also something called Q10, and these are again the elements that reduces your risk of developing any side effects of statins. So that's CoQ10. Okay, then there's another question I just seen here. Is it safe to take the valerian root or melatonin for sleep? No, melatonin is not harmful. And I see people and patients seeing melatonin, and they have not reported any side effects, and I have not read any harmful effects of taking melatonin. Certainly, melatonin helps to, it's not a sedative, but it just makes your sleep pattern and sort of regularizes your sleeping pattern. So if you want to sleep at a certain amount of time and you take melatonin, then it will help you to sleep. And actually it helps your sleep routine rather than working as sedative. So yes, melatonin will help to help you to sleep better. And certainly it will help you to regulate your sleep rhythm. And then I think we'll just take 1 or 2 questions and before we close. So somebody has asked, what is the type of cardiac stent good to prefer for coronary artery disease to reduce in-stent restenosis? Now, as you know, there are 2 types of stents. One is bare metal stent, and then there is something called drug-eluting stent. Drug-eluting stent is a stents which are coated with some drugs, and these drugs are again of different kinds. And different drugs, they act better. And again, there are different standards and different advantages of using different types of drug-eluting stents. So drug-eluting stents are certainly better in reducing in-stent thrombosis. But if the person is at risk, because these are the patients who would be on blood thinners, sometimes the blood thinners are very potent and can give rise to bleeding. So if there's an issue that somebody is at risk of bleeding, then we do not put drug-eluting stent, we put just bare metal stents so that the people can avoid being on these blood thinners. So I think that was the last question in the chat box that I can see. So just a final call for everybody. And I think there are just few left here. So if you have any question to ask, if you have any burning question before we wrap up and close the session, please, if you want to unmute your microphone, if you want to switch on your camera, please do so before I close the session. Yes, I can see Alpesh there. Yes, please, Alpesh. You have a question, please go ahead.
Well, you answered a couple of my questions, which I put in a chat box. Thank you for that. My brother-in-law back in India, he also asked one question. You gave a very good answer. Thank you for that. I enjoyed the session, and it's a great job. You made a best use of this World Heart Day, and yeah, I think all are benefited. Great job done.
Thank you. Thank you for that. Thank you very much, Alpesh. Appreciate it. Okay, so I think it is already late for Bhavnita. It must be what, 11:30 at your end?
Yes, 11:38.
Okay, so I'll not hold you long. So first of all, I would like to thank the audience for being here. And I believe there are a few attending from India and it's late for them as well. So thank you very much for attending this webinar. And your presence made it more successful. And I think I hope it was a webinar from which you may have learned something, you may have benefited. So thank you very much for attending. But I would like to thank, first of all, my guest presenter or guest speaker, Bhavnita, who has joined all the way from Mumbai. Thank you very much for being here, Bhavnita.
Thank you, Dr. Raza.
Much appreciate accepting my invitation. And
yes, I'm glad for that.
Yes.
I'm glad to be a part of this webinar and I really loved it. Thank you so much once again, Doctor.
Thank you. Thank you. Thank you.
Dr. Razak, I have a small question. Can I ask you?
Yeah, please go ahead.
Just a very short one. Everything is okay. There's a small blood pressure issue, for which my wife is taking the blood pressure medicine,
okay,
and it's under control. Should she take regularly aspirin or no?
I mean, I'm not sure if you would wish to discuss the other medical issues, because as I mentioned, that the aspirin is recommended based on the risk stratification. So what we do, we take into account the age of the patient, the gender, we take into account the other risk factors like high blood pressure, diabetes, smoking, and also the ethnicity, the background, ethnic background the person is coming from. So then we calculate the risk percentage. And if the risk percentage is beyond 15%, then yes, aspirin is recommended. But if the risk is low, then certainly aspirin is not recommended because it can be harmful. It can lead to complications like bleeding. So we should not prescribe the aspirin blindly to all patients who are hypertensive.
Dr. Razak, in this case, my wife has no background history, is absolutely fine. Everybody in the family was okay. And she has no diabetes, no smoking habits, no drinking. She's 70 plus. So what is your recommendation?
And any family history of heart disease?
No family history, nobody, none.
Yeah, so if she has no other risk factors, and if she only has high blood pressure, which again you're saying is under control.
Yes.
Age again is a factor. Ladies above the age of 55, they start to develop the risk same as men. So these are the two risk factors. But I believe taking these two together, I do not think she falls in that risk category where aspirin will be advisable. So my feeling is that yes, she should not be on aspirin.
Thank you. Thank you, doctor.
Welcome.
Thank you.
Okay, with that, I think it's time to wrap up the session. So thank you once again. Thank you very much, attendees, audience. And thank you once again, Bhavnita. I think Hadil is not here. Thank you, Hadil.
Doctor, there is one more small question regarding supplement. Is CoQ10 recommended to be taken, CoQ10?
Yeah, CoQ10, I just mentioned, I think there was a question regarding the statin. So CoQ10 has been seen for people who are taking statins. It reduces the side effects of statins. So people can tolerate statins better. There's no harm certainly, but yes, it is beneficial. And certainly for the people who are taking statin.
Thank you. Thank you. Thank you, doctor.
Thank you. Okay, thank you once again. So I close the session here. Thank you, Bhavnita. Thank you, Hadil.
Thank you so much.
Thank you, Riona. and I wish you all a healthy, and I do not say happy, but being aware of heart disease. And so please be safe. And if you have not got your heart checked, then please get your heart checked and get yourself screened. Thank you very much and good night.
Thank you. Have a great night. Bye-bye. Take care, everyone.
Good night, everyone. Dr. Syed, Raza, one suggestion for you.
Yeah, please go ahead.
Yeah, rather than waiting for World's Heart Day every year, I think we should have more frequent webinar like this, maybe every quarter, for benefit of all of us, with some more updates.
Yeah, certainly we can. We do have from time to time, but this is the annual event I hold every year, World Heart Day. Yes, we can do that. Not every quarter, maybe once in 6 months.
That would be good.
Yeah. Okay.
Right. Thank you. Good night, everyone.
All right. Thank you. Thank you very much. Good night.
Night.